intradental layer from the mesial and distal aspects of the tooth surface, which is also known as cylindrization, aerotic stripping, and reproximation, different names of interproximal reduction. What is the safe limit? 0.5 to 0.75 millimeter per tooth is the safe limit. You cannot go for the excessive IPR. Okay? Especially in the anterior region, it's up to 0.6 millimeters, and in posterior regions, it can be up to 0.75 to 0.8 millimeters. So that's the safe limit of the IPR, and you have to strictly follow this. You need to be mercy to the IPR 30. Otherwise, what will happen? What are the consequences? It will result in sensitivity, increased caries, index, and so on. Now, we all know that these IPR is basically to relieve the crowding in order to create the spaces to preserve the natural shape and anatomy of the teeth. Why do you do IPR? First of all, it simplifies the case. Secondly, it speeds up the case, increases the stability of the case, improves the aesthetic results. Okay. Now, what are the indications of IPR? First of all, mild to moderate crowding. Then, significant Bolton discrepancy. You are aware of the Bolton discrepancy, where you have excessive tooth material access. Then, the triangular and barrel-shaped teeth. The teeth which are macrodots, that are enlarged in shape. Then, narrow pulp chambers. Lower incisor extraction cases, you have to give the IPR to correct these black triangles. Okay, now what are the contraindications of IPR? First of all, poor oral hygiene. You cannot go for the IPR. It will result in increase the caries and plaque index. Secondly, large pulp chambers, orthodontism. That is the enlarged pulp chambers into the teeth. You cannot treat them with IPR. And third is enamel hypoplasia. The hypoplastic enamel surface cannot undergo IPR. Now, the Turner basically gives this rule. What does he do? He suggests that when the distance from the interdental contact point to the crest of the bone, it increases from 5 millimeter, it results in black triangles. Can you see? At 6 millimeters in the smaller triangle, 7 it increases. But up to 5 and 4.5 millimeter, there are no black triangles. So he suggests that the interdental contact point to the distance of the crest of the bone should be up to 5 millimeters. Okay. Now, the different methods of IPR. The question was these are the three popular methods of the IPR. First one is the burst using the high-speed handpieces. Second is the disc, double or single-sided in a slow-speed handpiece. And third is the most common single or double-sided IPR strips, abrasive strips. Okay, so which one is the most common which you practice in your clinic?
Abrasive strips.
Abrasive strips, because it's also a safe one. Okay. Now, how to measure IPR? As I told you, you don't have to do it bluntly. What is the safe limit? 0.5 to 0.75. So these are the gauges. And you have to use it very light, gentle motion, and you have to measure it at each step. Okay? And at the end, you have to smooth the IPR surface. Yeah. Whenever we send you the aligners, we send you an IPR form in which we have mentioned which tooth the IPR is करनी है, and you have to follow exactly the instructions. Which stage पे करनी है, that's also mentioned very straight away in the form. I'll show you the form. Okay. Okay. So this is the IPR kit with the IPR strip holders, the discs, the gauges, slow speeds, and hand pieces and high speed hand pieces. Okay. Now the IPR should be done properly. As you can see, this is an incorrect IPR. The contact point is intact, it's not broken. So in that case, there will be no movement. Movement will be small. This is the actual and the correct way of doing the IPR. Okay. Now you can appreciate this figure, step by step, how we do the IPR step by step, and how the movement takes place in this region. First of all, we are doing the IPR and the second premolar on both sides. So keep observing. the IPR on the nasal and distal aspects of the second premolar. One by one, the lip is retracted, and one by one, the entire arch is distalized and the crowding is removed. Okay? So this is how actually the lip and the lines take place. You obviously have to recommend flossing and all the oral hygiene measures to the patients. So जब भी आप IPR करेंगे उसमें issue आएगा. We have to give strict oral hygiene measures instructions to patients. When during the treatment, you have to ask the patient to use the mouthwash, to use the flossing, to brush regularly even after every meal. Okay? Okay. So now it's very important to be updated. Okay? Okay, let's start. IPR will need to discuss facts of the second premolars. Yeah, see, they're retracting now. This is how to read the crowding in aligners, step by step.
मैम ये एक ही ट्रेन ये सारा हो जाएगा?
No, I am telling you these are different steps of the aligners. And that every movement is in every other step of the aligner. ये एक साथ नहीं होगा. As you move on to the next set of aligners, you get the next movement. As you move on to the other set, it will be followed by 5 to 6 sets of aligners. Obviously. You want free treatment, I guess. अब जाने सारा प्रॉफिट थोड़ी रखना पेशेंट का. हमें कुछ ना मिले. Okay. So now. Definitely. On the day one, when we will be sending you a diagnostic setup for approval, उसके साथ अभी बात पता होगी कितने ट्रेस लगेंगे, कितने सेट्स लगेंगे. Everything will be there. ठीक है, वो अभी आ रहा है upcoming slides में. I'll let you know. ठीक है. Now it's very important to be updated because now you know everything is literature based. Books to obsolete हो गए. ठीक है. You know the old crow and the new crow concept. Old crow was like having water by inserting these rocks and stones. The modified crow says that this is the more easiest option to insert the straw directly. Okay? So it's very important to be updated. Now, there are concepts saying that the IPR increases the risk of caries. So the latest research says that, the finding says that the risk of caries is not affected by aorta stripping or the IPR. Okay? Now that's the newest and the latest concept, that the IPR does not increases the risk of the caries. And these journals, these articles have been published in the international journals. This is again systematic review, which says that the IPR or IER does not increase the risk of caries on the treated teeth, provided you are in the normal limits. It's not that excessive curdy and now you're saying the caries is over. No, aorta stripping is another name of IPR. Okay. Now, learn to review the case online. You were asking me कैसे पता चलेगा. Okay? So how you can review the case online on the ClearPath setup? Now, when the setup is being done by our team and the setup is ready, we send you a link. Okay? Through email. The regional officer drops in contact में continuously touch में है. They will be sending in an email the link as well as the access code. You have to insert this code into the link. And what you see, you will see the diagnostic setup in 3-dimensional view. Again, all the 5 views before and after. This is the lower occlusion view before, after. Frontal view before and after. Similarly, right and left lateral views before and after. And this is 3-dimensional. Now, of course, I cannot give you the 3-dimensional picture. So you can simulate this, you can see this in a 3-dimensional view. And once the setup is approved by the doctor or orthodontist and they give us a signal to proceed, it goes for the manufacturer. If the doctor wants any changes or modifications, we address them first. We send the setup again. Then final signal will be given to us by the doctors. Okay, now I am happy and satisfied with the setup. Please proceed. So it will go into the manufacturer. Okay. Now with this, you also get the IPR reduction form, as I mentioned. Okay, in which we will be showing you कि हमने IPR कहाँ करी, कितने millimeters की करी, कोई extraction करी or not, कोई attachment लगाई है नहीं. So this is an entire instruction instruction form. Okay? That will be showing you all these things. I think there's some sort of disturbance is going on. Please can you share with us क्या बातें चल रही हैं?
आप इस कैंपस कह रहे हैं कि IPR अगर हमारे पास इतना कंट्रोल सिस्टम है तो एक ही दफा क्यों नहीं IPR करना?
अभी ये भी बताऊँ ये IPR slip आ रही है. ठीक है, this is the IPR slip in which it's mentioned कि कौन से स्टेज पे आपको IPR करनी है. So, in this case you have to done IPR before doing second alignment. कौन सी पद्धति करनी है किसी नहीं करनी है. It's all given and all instructions are being provided by a team. ठीक है, EPD elastic button technique अगर applied है तो which tooth पे applied है. Again on this stage you have to apply. If an extraction has to be done, on which stage you have to do the extraction and which tooth you have to extract. So all these instructions are clearly provided by us in this form. ठीक है? Any queries now? Okay. So this is next one is gapping aligners and monitoring of the aligner patients. Now once it's manufactured, it will be shipped to you. We have received the record form. Okay, when this box is being shipped to you, you will receive these things. Okay, aligners and the movement record form, the case details and the IPR record slip I just discussed. Okay, and you get this box with the aligners, all set of trays. Okay, there's a retention or storage box, and there is also the guidebook, a small booklet, which gives you the instructions that the patient has to follow. This is a movement record form, in which will indicate the concept of the movement with all the abbreviations, mesial translations, intrusion, extrusion, at which stage, this is the stage number, this is the tooth number. And we just mentioned for your information that this stage पे हमने कौन सी tooth movement की है, to make it more clear. Okay? Then you have to go for the aligner insertion and removal and you have to guide the patient accordingly. The aligner insert कैसे करना, of course the equal forces are applied by means of the thumb on the posterior region and by snapping action you insert into the anterior region. Same way you have to remove. The guidelines book में भी दी हुई. There will be a booklet in the box too that will guide you further कि how the patient have to wear it and how to remove it. ठीक है? And you have to evaluate this completely on the patient's part also. कि वो पेन क्या आपको दिखा है. You have to check it if the patient is wearing it in the right direction or not. Now, what you have to instructions you have to give it to the patients. First of all, the number of hours to wear. कितने hours के लिए wear करना है? 22 hours. That's a standard. Then for how many days? A single set of tray for 2 weeks. That is the 14 days. Once 14 weeks are done, 14 days are done, you move on to the next tray.
अगर पेशेंट 22 आवर्स नहीं पहन रहा तो उसका टाइम हम बढ़ाएंगे 3 वीक्स तक.
No, you have to counsel the patient. क्या यदि नहीं पहन रहा तो उसमें फिटिंग आ जाएगी. Next aligner properly seat नहीं होगा. Require movement नहीं होगा पिछले step में. वक्त पता चल जाएगा.
22 आवर्स तक ये पहनना पॉसिबल है.
Yeah, it's possible. 2 hours to margin दिया है. That's for only while brushing. You have to consider Gujranwala patient.
इसमें टॉप मूवमेंट जो है वो कैसे
Elastic button techniques that we expect. ठीक है? So again you have to ask the patient that the patient will only remove the aligners while eating, brushing and flossing. Rest all the time the patient has to wear it. Unless and any emergency, socially sensitive patient attend करना है, तो wedding attend करनी है, you can get a margin to do maintenance remove कर दिया. Otherwise you have to be strict के वो 22 hours time. Yes please.
अगर वो 22 आवर्स नहीं लगाते हैं 18 आवर्स लगा के वो नेक्स्ट सेट में मूव कर देते हैं तो कोई हैजर्ड्स होंगे?
If you see the patient is moving comfortably on the next set of the aligners, then it's fine. अगर movement नहीं होगी, तो next set of aligners insert ही नहीं होगा. Okay? So it gives you confirmation that the required movement की previous step that has been achieved or not. Yes, please.
अगर हमने patient को guides check करनी है और उसी patient state का use होगा ट्रेन उसको हम उस अलाइनर को लगा के उसका चेक करेंगे कि उसका कंफर्ट में या थोड़ा यूजमेंट में then we move on to the next.
Exactly. You will see the next step also. अगर पिछले step की सारी movements हो चुकी हैं, you can easily move on to the next step without
वो हम खुद लगा के पहले चेक करेंगे कि पेशेंट को जरा
Yeah, that's very important to monitor the patient.
अगर वो लूज है तो फिर हमें पता चलेगा कि ये पहना है.
Next step easily insert हो रहा है, इसका मतलब previous step की सारी required movements हो चुकी हैं. बता सकते हैं.
Excuse me?
Yeah. Otherwise next step sealing हो. जी.
सारी ट्रेस की होंगी वो एक ही स्टेप में हमें आ जाएंगी सारी ट्रेस?
I answered that completely. Sometimes we supply you in 5 stages. Sometimes we give you all the stages in one go. It all depends on the doctor's preferences, what they want. Okay? If you want them in one go, we can give you in one go. अगर बहुत ट्रेन है तो कॉम्प्लिकेटेड केस है, बहुत से एक्सट्रैक्शन है, then we give it in set of 5 just to monitor each of the problems.
मिनिमम 5 में आएंगे मिनिमम?
Yeah. No, not necessary. ठीक है? Again, instructions to be given to the patient. You have to ask the patient to maintain cleaning of the aligners, light toothpaste and brushes to clean करके पहनना है, not to break it, not to misplace it. ठीक है? Slide, smooth motions के साथ have to remove and insert back, and again have to store the alignment of the box. Okay. So once you insert the aligners, the movement starts, and it initiates the osteoclastic and osteoclastic activity. Now. Okay, can we proceed please? Okay, so now it is also being said that these appliances, whether the fixed or removable, they causes the apical root resorption. So it has been proved with the latest research that the apical root resorption is minimal with these removable aligners. Okay? It is said that the comprehensive treatment with clear aligners, they resulted in minimal root resorption as compared to the fixed orthodontic treatment. So another plus point for the clear path aligners. So now, how we monitor it? For the monitoring, first of all, you have to see the compliance issue as said by Dr. Aisha Imran. You have to check it at every step to properly insert हो रहा है कि नहीं हो रहा. Then contacts and fitting should be checked as I told you. कि properly fit नहीं हो रहा है इसका मतलब है कि previous set is not worn properly. ठीक है, movement सही हुई नहीं है, फिर see properly seat नहीं हो रहा. Then there should be any aligner mishap, if cracks आ गए, fractured हो गया, so you have to respond or you have to contact immediately to a team for the fabrication of next set. Any tissue impingement or any hindrances on the tissue part, the soft tissue rotation over here, you have to notice that. Then IPR and EBT attachment. If there are any instructions for that, you have to see कि कौन सा stage पे insert करनी है, कौन सा stage पे IPR करनी है. Okay? Now, sometimes when you move on to the last aligners, you have to check if all these spaces have been closed, the chief complaint of the patient is being addressed, and are the teeth properly aligned at the end of the treatment as desired by the patient. So you have to see all this thing in the last aligners. अगर इसमें कोई patient को complain है, कोई resident spaces रह जाते हैं, तो you can contact our team and we can fabricate you or give you another set of aligners, and then you order for the retainers.
For example, there are few limitations that at times, despite all the good heart to perfect our product, yet at the end of the case, we are left with some teeth which may be deficient in structure, and we need to go for chemical treatments, or we need to go for build-up. So all these things are discussed by you as well during the...
Yeah, you can discuss that in between with us. You can contact us. We are here to sort out and we'll give you the feedback and the treatment plans accordingly.
Even after the...
Yeah, we are always there. Clear path is always there to serve you at your end. There is no communication gaps. You can easily communicate us with our email, and our regional officers which are contacting you, they are always in contact with you. Okay. So now the second last one, the use of auxiliaries with the aligners. Now what are the auxiliaries which are used with aligners? First of all, the attachments or the bumps. The question you asked, Dr. Umar. Okay? These attachments, can you see? And secondly, elastic button technique, EBT, which you asked, elastic button कैसे देते हैं. This is a cutout into the aligner tray, जिसमें हमने button लगा दिया. This is a split hook-like structure जहाँ से elastic insert होते हैं. ठीक है? Yeah, this is the aligner. Aligner के ऊपर लगाओ इसे hook-like structure. जी? Not necessarily जहाँ पर need है, जहाँ की need है. ठीक है? So what these attachments and elastic button techniques do? First, they give you the retention. On all those places जहाँ पे आपको extra retention की ज़रूरत है, these attachments give you the retention. They give you all sort of vertical movements for extrusion करने को intrusion करनी है. They give you the cross-bite corrections. They give you inter-arch corrections like class 2 corrections, class 3 corrections, and irritation corrections, and unpredictable movements like the crystallization of molars. For all these purposes, modified elastic button technique. Now what is that? In this technique you either modify the button or you modify the manner of elastic insertion. Like this you will see, this is used for crossbite correction. Here also you are applying the couple system for correcting this rotation. यहाँ से भी insert किया, यहाँ से भी insert किया. So that it will correct it will derotate the tooth and it will correct the rotation. Now another question you asked, torque कैसे ठीक करेंगे, tooth movement कैसे ठीक करेंगे. This is again this modified elastic button technique. What is that? The buttons they are applied onto the gingival third of the tooth surface. ये आपने power chain दी. So they will bring out the mesial tipping of the roots. Suppose if you want to correct the midline diastema, so you have given the buttons on this gingival third, यहाँ पे आपने elastics दे दिए, and it will correct this midline diastema by causing the mesial tipping of the roots.
What is the movement of it?
Sort of. Top. Yeah, because that is close to the center of resistance. So if center of resistance is close, जाएंगे उतनी ज़्यादा body के top movements. This is a picture. You can see this case. ठीक है? In this case, you can see these crowded canines दोनों side में. It is severely crowded. It has been treated by the extraction of lower premolars. ठीक है? किसी ने मुझे कहा था कि premolar extraction का case दिखाएं. ठीक है? So this is the case. You have extracted the lower premolars and now you are retracting them with this elastic button techniques. So this is the how it is.
extraction cases में almost कितने sets होते हैं इस तरह के cases?
It ranges to you want extraction in all the four quadrants or just in the upper arch or just in the lower arch. जितनी complexity increase होगी उतना tray increase होगा, 25 से 30 trays भी हो जाती हैं.
अगर आपका सिंगल साइड का है और 4 extracted है.
Lower four pores, all four pores. All four will can be 30 stages. Provided कितनी crowding relief करनी है आपको.
अगर सिर्फ lower 4 है.
Lower pores है तो decrease हो जाएंगे. Then it can be 27 trays, 25 trays. If it's a non-extraction treatment, it can be limited to 18 or 20 trays. Yeah.
I think इसमें there is anguish loss काफी control.
Yeah, because actually they are taking anguish from all the teeth. Exactly. That's another very positive point for the use of these aligners. Okay? Now another case. Sometimes failure. Doctors do that because they started being fixed and later on they do with the aligners. Fixed ortho में इनको retention बहुत अच्छी चाहिए होती है. That's very mandatory part. You cannot leave the fixed cases without retention point पे lapse हो जाएगा. You know, fixed retention इतने आसानी से कुछ सर्फेस से निकल जाते हैं, पेशेंट को डिटैचमेंट का पता ही नहीं होता है, एक तो से बीच में लाए थोड़े दिन बाद वो क्राउडेड होता है, इसी के वहाँ तो वायरिंग इट्स वेरी कॉमन. You have to monitor it.
Sometimes